Hi folks, welcome to this, our video tutorial on how the humanistic perspective can be applied to health and social care. As you're aware from our lessons, Carl Rogers is famous for developing a particular type of counselling based on unconditional positive regard from the counsellor to help the individual develop a more positive sense of self. Unconditional positive regard refers to the idea that the therapist supports and validates the person's experiences, feelings, beliefs and emotions unconditionally, for example, without making a judgment about whether they are good or bad. In this video tutorial, we will consider how the humanistic perspective can be applied to health and social care. So we'll look at things like how the humanistic perspective can be used to achieve empathy, how the humanistic perspective can be used to achieve understanding, how it can be used to achieve active listening, and how we can use the humanistic perspective to support respecting other individuals and using a non-judgemental approach in health and social care. A crucial approach in working in health and social care when helping others is to develop empathy. Unlike sympathy, where we feel sorry for someone, empathy requires us to really listen to the other person, be in tune with their emotions, and respect them for who they are. Achieving empathy isn't always easy, as we don't always understand why someone feels so bad about a particular issue that we could quite easily dismiss. However, as practitioners, if we try to respect the individual we are working with and understand that the issue is of crucial importance to them, we can come closer to demonstrating empathy. True empathy requires us to put aside judgments about other people and to do all we can to put ourselves in their shoes. So, understanding. Rather like empathy, understanding is of crucial importance when applying this perspective to health and social care. In fact, Rogers often refers to more than just understanding at an intellectual level. He talks about empathic understanding, which involves using your own emotions and sensitivity to become more of an effective helper. As practitioners, it is difficult to try and control your own personal emotions, and all too often our own personal experiences or judgments can dominate the way we relate to others. We think, well, that's not a problem, they should just pull themselves together. I've dealt with worse. However, on reflection, these statements are a major barrier to understanding and will not help the client or patient at all. Instead, we need to listen carefully to what is being said and to ask probing questions that enable the individual to break down the problem and to recognise its component parts. Useful questions might include: how does this make you feel? Can you identify what it is you're afraid of? Could you tell me a bit more about that? That seems to have upset you. As practitioners, we must remember to put our own emotions to one side and try and place ourselves in the shoes of others. Another key feature of the humanistic approach is that of active listening. All too often our interactions with others, what we think as a conversation, is merely two people queuing up to talk. We just wait for the other person to finish what they're saying so that we can have our own say. This is the opposite of active listening, which involves a very focused approach. We need to avoid daydreaming and distractions and listen sensitively to the meaning and the emotions behind the other person's word. Attention is also paid to the person's body language and facial expressions. The active listener suspends all judgments about what is being said and seeks to use empathic understanding. When the listener does intervene, it is not to pass judgment, but to interpret what the other person has been saying or to check understanding about what they've just said. So as practitioners, active listening when working in health and social care is a crucial tool. Giving people respect may seem an obvious feature of the helping relationship in health and social care, but In fact, it can sometimes be quite difficult to achieve. If we find it hard to identify with other people, for example, because there are differences in gender, possibly social class, ethnicity, religious beliefs, language, or cultural differences, then we may find ourselves taking a judgmental stance. As practitioners, we need to be mindful of this, as this is a major barrier to respect.